following podcast is a production of Radio Felician, the voice of Felician University of New Jersey and the home of alternative rock done right. Available via iHeartRadio, TuneIn, the Radio Felician app, and at radiofelician.com.
Radio Felician University.
Welcome to The Felician Lantern, shining a light on everything nursing. A podcast from Felician University in New Jersey, exploring current issues in healthcare, speaking to leaders in the field, and preparing the next generation of nurses. Your hosts are Dr. Daria Wazak and Dr. Elizabeth Van Dyke, Associate Deans of the Felician University School of Nursing.
Welcome to the Felician Lantern. I'm Daria.
And I'm Liz.
Here with us today, we have Juliet Gonzalez. She is one of our current DNP students, the Doctoral in Nursing Practice program. She had an amazing trip that we're going to talk about today to Ghana, and we're going to find a little bit more about that. And I thought it really aligns well with our Felician core values, and it just seemed like a wonderful experience to share. We love in the Felician Lantern to share not only what our faculty and staff are doing, but what our students are doing as well. With that, I'd like to introduce, or I'd like Juliet, if you could introduce yourself.
Hi, I'm Juliet Gonzalez. I'm a DNP student at Felician. I'm in sort of the last year-ish of my program. I'm doing a project on sepsis management. And in October of last year, I went to Ghana for a week to do a medical mission with a surgical team. And it was really an incredible experience.
What organization was it that you went with?
Sure, it's called Operation International. And they do mostly surgical missions like all over the world. So they go to Ecuador, Ghana, a lot of different places. So this was the inaugural trip for this particular team of surgeons. So we had 5 surgeons. We were in a place called Techiman, and it's sort of central Ghana. So the place where we were was like a hospital, but like not what we think of like a hospital. So, it was really a culture shock when we first got there. We had 2 general surgeons, a plastic surgeon, head and neck surgeon, and urology surgeon. So they basically keep a list of, when we got there, was 700 patients that had been seen by doctors there that needed surgeries they can't do.
Wow.
Yeah. So when we get there, they basically review the chart. Well, so the week before they call them and they say, okay, these are the doctors that are coming. They work with the doctors there. They say, we think these are the patients who, you might be able to see. And they sort of try to make a schedule. They're like, these people are traveling sometimes for days, like walking for days to get there.
Is it adults and children that they see, or just adults?
Both. So the general surgeons did a lot of adults, like hernia repairs. They did a lot of goiters. And then the plastics people really did most of the kids, and it's really kids with burn injuries. It was so sad. So I guess just because of they use open fire for a lot of cooking and heating and everything, a lot of the children get burned. So they were trying to do surgeries to help with those sort of burn injuries.
How many other nurses were there?
I think our team was 14 people total. We had 5 surgeons and we had 4 CRNAs, and the rest of us were nurses. But we stayed in like a hotel. We had a bus that took us back and forth to the hospital every day. We worked like 15-hour days because, we wanted to maximize the time that we were in the OR and we were doing work. And we ended up doing 98 surgeries in 5 days.
Wow.
So what kind of preparation goes into before you get your plane tickets? Like, how did that sort of kind of come together? How did you get involved in this organization and, make the trip over?
So I really wanted to do a trip. I've always really wanted to do a trip like this. And I had reached out to a bunch of different organizations and they reached back to me. So it's actually interesting because it's harder to get into these trips than you think it's going to be, because a lot of them have preset teams that go every year. And so I was so excited when they wrote back to me and said, "Do you want to join this team? They're going in October." I said, "Yeah, absolutely." They organized everything from visas to plane tickets and all that. So honestly, I had no idea what I was walking into. And it was just, I mean, really in the best way. Like, I just now, like, so I'm going to go back this year and I feel like it's going to be such a different experience. And I'm going to actually do so. One of the things that they really love about their organization is passionate about is education. So they teach, so they were hand in hand, the surgeons were scrubbed in with the local medical students. So they taught them how to do a lot of these procedures, which is like just so incredible because then, these people have seen the procedures done, they've done them themselves, and then they might be able to, once they're done with medical school, do the procedure there in their country. So this coming year, I'm planning to do a surviving sepsis campaign education with the nurses and the nursing students there. So working with an infectious disease doctor who's going to join our group, and we're going to teach them about sepsis. And sepsis is high mortality, especially in low and middle income countries. It kills people in ways that, like, here we would never see it. So just simple things like timely antibiotic. They have antibiotics. So like just timely dosing of antibiotics, fluid resuscitation, things like that are simple and can save lives. So I'm excited for that.
This is the Felician Lantern, shining a light on everything nursing.
What surprised you the most coming in?
Every level. I think the simplest thing was they don't have bed sheets. It's just like a luxury that we have that they don't have. And the first day I was like, we can't just leave the patient on a stretcher like with no sheets. And like it was just like that's like not even a thought for them. Like that's not, they don't have the means to like do the laundry. Like simple things like that really took me aback at first. And then you just get used to it. And the way that they treat resources. So I think it was one end of a spectrum and we're the another end of a spectrum. So like if you think of like what we waste in a hospital, like we throw everything away. We have so many one-time use things. They don't throw anything away. Even to the like and like even like their surgical gowns, like like the gowns that the surgeons wear, they wear cloth gowns that then get laundered. Like we don't, like in here we just use like paper gowns that get thrown away. And it's just like it's resource management. It's just like they actually reuse like ET tubes, which like blew me away.
It would be hard to be prepared for that for that.
Yeah, yeah. Or like even like if I'm helping clean a room, I'm like starting to throw things away. They're like, no, 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 what are you doing? Don't throw that away. I'm like, oh, okay. Like, here it's just we do, and we waste a lot. And even speaking to resource management, I mean, they don't. I think I mentioned this to you, but that they think of death so differently than we do, and it's sort of just something that happens there, and you move on. It's sad and it's terrible, but it happens, and you move on. Like I feel like here, our mindset is like nobody should die. We should like keep them alive on a ventilator, do this. Like they don't have the resources to do that, so it's just not even a question, which was really interesting.
So do you have any particular stories involving, getting to know some of these patients, these families, their stories in particular that really kind of touched you and really kind of changed your perspective of this type of medical mission?
Yeah, I mean, one little girl I keep thinking about, she walked with her dad for 2 days to get to the hospital. And when she got there, she got sick. Like, little kids get sick when they're outside. And so she came all the way to have this surgery, and she got there and she had like a stomach virus. So she was throwing up a little bit and they didn't feel like it was safe to give her anesthesia. So they put her in the ward and they just watched her overnight, and she got better and we were able to do the surgery the next day. So that was really good. But like she just like to think like you have to walk 2 days with like a 3-year-old. It's just unimaginable.
It's amazing.
Uh,
Being around, pediatrics and kids just want to be kids even when they're sick, So and
yeah,
that's pretty universal. So trying to keep a 3-year-old happy, especially with the
yeah,
stomach bug.
yeah. It's so yeah, and I wish I had more photo. I do have a ton of photos, but I could show you guys like the hospital is like a compound sort of. So you say you're transferring a patient from the surgical center to the ward. It's like you go outside. So it's just like interesting, like to see like patients on stretchers just being like wheeled down the street, and dirt roads. And so that was another like culture shock thing where I was just like, oh, they're just gonna like go outside with that patient. Um, and when they get there, they just write like OR on their gown in a marker, like the things like we would never do.
So no formal admission process there.
No, I was like, do we need to like check their name again? They're like, no, that's him. Okay. But it was so good. It was a really good group. And I think I did tell Daria like about the Dr. Joe Lewis who led the team, and he was just a fantastic. Um, he's a general surgeon. He was trained in Long Island, I think it's Stony Brook, and he is working in Florida now. He's a trauma surgeon, and he is just wonderful, a wonderful leader. Um, really like a type of charismatic leader that I haven't worked, a type of leader that I haven't worked with before. So it was really inspiring to me.
Just going to ask you
Um,
about that. What was it
yeah,
about him that you think showed such good leadership traits? What was unique?
Um, well, he did. I mean, he knows a lot. I mean, it's clear that he's had some formal training in leadership. Like he knew a lot of like team building stuff, which is great. But I think the most important thing was like one of the patients got really sick and ended up it was a they ended up not doing well, and she died, and I was really frustrated. And I was like they don't even know how to do CPR, right? I was so frustrated. I was like, how is this even possible? And he was like, Juliet, like they don't know what they don't know. And like that just really resonated with me. And he was like, they're doing the best they can do. And I was like, I know, I know, but it's just like it's like a simple thing like CPR that can save lives. Like so we're gonna definitely teach them CPR this year when we go. But yeah, it was so frustrating to me. Like that whole situation was so interesting too, because like even the local doctors were like, why are you doing all of this? Like she's too sick. She's not going to make it. Like we don't think of it like that, right? Like we'll do CPR, we'll take them back to the OR, we'll do this and that. And like they just to them it's just like a waste of resources. So I really just learned so much. And he was just, I mean, Dr. Lewis, he was just a good team leader.
So I'm just wondering, I
Oh,
know you had very long days, 15-hour days, and probably you slept most of those other hours, but anything that you did with the team as far as like that team building, just to kind of debrief or that downtime that you had before you went to sleep and had another busy day the next day.
yeah. So we had dinner every night together when we got home, but which would be like maybe 11 p.m. And he always had like an activity, so he would have us do like, I'm not going to remember all of them, but like I know one night he said, okay, I want you to say one thing that was really good from today, and one like thing that you're looking forward to tomorrow, and one thing from yesterday that could have been better or something like that. Like so we would do all these activities, and we were tired and we were like, can we just go to bed? But um they're good things to do.
So like a debriefing and
Oh yeah,
reflection.
yeah. Hmm.
That makes sense. What was it like where you were staying?
It was actually like nice. It was a hotel. It was like in a gate, like a locked gated like area. And they were just like normal hotel rooms. They had hot water, like there was, and we had dinner there every night. Like they cooked for us, so it was nice. Like I had no complaints. And some people were sharing rooms with people they didn't know, which was funny because they only had one big bed in each room. So I don't think that those people were like, oh, I didn't realize I was sharing a bed with like the other CRNA, but that was the only like like housing thing that was like, but like everyone just dealt with it and it was easy. I actually ended up getting my own room just because I got lucky.
So coming home, what are your thoughts, reflections? I know you're looking forward to returning again the end of this year. You said October, going back in October later on this year. So what are the things that you've brought back to your practice, to your nursing practice from what you've seen in Ghana?
It's hard to say that because a lot of it doesn't translate. So, I mean, some things were like a little frustrating. Like when I got back and like we have patients that like waited an hour and they're like complaining and, you know, yelling at us and doing this. And I mean, you would have people in Ghana sit there all day and they would not utter a word because they were so grateful to be getting this treatment. So like that was a little hard coming back. But you just get used to it and it is how it is here and that's fine. But like in terms of like my work and everything, it's just so different. I work in like this brand new building that opened in 2020 that's super high tech. It's just it couldn't be more starkly different. So a lot of in terms of like my practice and my work, it doesn't translate. It just makes me want to do more things like this where I can make a difference to people who just need it so much.
When you go back, will you be with the same team or is that not clear? Same location, same team?
Same location, same team for the most part. I think some people can't go back next year and then other people are joining the team. So it'll be a little different, but for the most part, like I'll definitely know people. Like this year, I didn't know anybody going. So it'll be nice to like see familiar faces and even some of the local people we have kept in touch with like on WhatsApp. And so it'll be nice.
Do you have any recommendations for students or nurses out there? What kind of nurse would be good to look into this? What are your recommendations for other people having an experience like this? Should they have some years under their belt or is it okay for a student? What are your thoughts on that?
I think as long as the person is open and willing to help, to do whatever you need to do. I mean, like I'm working as a nurse practitioner there. I've never worked in an OR. I've never scrubbed in. So I literally did a crash course in how to scrub in to an OR and sort of if you can like hit the ground running and you want to learn and you want to be helpful, I think anybody on these trips is helpful. Like as long as you're willing to do what's needed and you don't, so I think any student that's passionate about learning and passionate about travel doesn't care about things being fancy or nice, that they would get a lot out of it.
Got to leave the Gucci shoes at home, huh?
Yeah.
Anything else that you'd like to mention that we haven't touched on about the trip that you'd like to share?
I just think, if any of the students are interested, they can always reach out to me and I can chat with them or get them in touch with the organization. So just let me know.
Well, thank you so much. I really appreciate you taking the time out to share your trip. And I know I've talked to you in the past about the trip and it was so inspiring for me to hear what it was like for you and how it impacted you. And well, hopefully it was just as inspiring to those listening to this podcast. Thank you so much.
Yeah, thank you guys very much.
This podcast has been a production of Radio Felician, the voice of the Franciscan University of New Jersey. The views expressed are solely those of the hosts and guests and are not official statements of Felician University. Visit Radio Felician on the web anytime at radiofelician.com. Want to send an email? Reach out at radiostation@felician.edu. Radio Felician, the Falcon.